Thank you very much. Believe me, Dr. Thomas, the white women spend a lot of time at the hairdressers too, and I, was reminded when you talked about that. My hairdresser and I have had a relationship longer than my husband and I, and he is a gay black man from Philadelphia, and we learn a lot from each other in our conversations. It's a wonderful experience, and I often think of him as my therapist. I want to go back to some of the issues on aging. I was struck, folks talked about ageism, and even among this room, there are a lot of jokes about, oh, I'm old, according to that, I'm already in cognitive decline, and our society just really makes all of us think we shouldn't get old. And what I really want to bring to you, one of the things that has brought me into the aging field is my family. My mother died of breast cancer when she was 51. So every day that I get up and I'm older than 51, I'm very happy for that and thankful that I can live to be an old person. My dad was the total opposite end of the spectrum. My mom was a social worker and my dad was a psychiatrist, which you'll see why I'm very interested in integrating medical and social services. My dad had Alzheimer's disease, and we saw his decline from 75 to 81. So I've seen both spectrums of aging, and it's a very interesting field. And the good news for all of us who are getting older is we're not alone. There are a lot of us getting older. Well, if I can figure out how to advance the slide. There we go. Here's the overview of my presentation. I want to talk about the key themes of the White House Conference on Aging, which was held in 2015 under President Obama. And second, the community living challenges for people as they age. And then I really want to leave us hopefully on a more hopeful note on some of the programs and strategies that we are using to address some of these challenges. There were 4 themes in the White House Conference on Aging. I could talk about each of them for all day, but since we're here on health literacy, I'm going to focus mainly on the healthy aging. But if you're not familiar with the work we did in the White House Conference on Aging, you can find our report at whitehouseconferenceonaging.gov. So it's pretty easy, and there's a lot of good information about all of these issues. On healthy aging, we had key themes, and one of the great things about being at the White House is you can bring together all aspects of government. So my background is mainly in healthcare. I'd worked in Medicare and Medicaid, but was able to see and learn about programs at HUD, at the Department of Labor, at Treasury, we worked with so many different agencies that I frankly had no idea they were doing things in aging. So it was a wonderful opportunity. Transportation, which is a key one there too. We focused on promoting health and preventing injury on physical activity. You know, I tell people, and you're a bunch of researchers in the room, the best thing you can do is move. All we see with all the research, whether it's our physical health or our cognitive health, it's being physically active is the most important thing. Nutrition, we also talked a lot about, and what we know about nutrition and aging. A lot of people just don't know what's healthy food. Nobody's taught them. Nobody's worked with them on that. Preventive health services, Dr. Thomas talked about that. We did a lot of research on why people don't take advantage of the Medicare benefits that are free to people on Medicare, and especially in minority populations, why they don't get the flu shots, why they don't work on these things. We have a lot of work to be done in this area. And some of it is on the health professionals and really not explaining this well to the people that they care for. And then finally, we focused on managing chronic conditions. Falls prevention was a big aspect of what we focus on. Each year, 1 in 3 Americans over age 65 falls, and the fears of falling may lead them to limit activities, which actually then worsens their mobility, increases their risk of falling, and detracts of quality of life. We did focus on optimizing cognitive health, and while 70% of older adults report no cognitive difficulties, some serious threats are with brain health and age. And estimates are that 2.9% of people 65 to 74 have Alzheimer's disease, but this rises to 32% over the age of 85, according to the CDC Healthy Brain Initiative. Housing and transportation was another thing that we focused on, in maximizing independence and talking about ways that we can address older adults and their needs for housing and independence. And then finally, we focused on promoting community and civic engagement. Being active in your community, being attached to others is really important to healthy aging. Here is a slide picture of an event that we did, and we work very closely with the National Institute on Aging on their Go for Life program. If you're not familiar with it, I would encourage you to look at it. It's very well designed to work with older adults to get them moving. This was a march that we did on the Mall with the NIA director, Dr. Richard Hodis, Surgeon General Vivek Murthy at the time, Donna Richardson from the President's Council on Physical Fitness, Sports, and Nutrition. I'm like Dr. Thomas, when I wrote this, I'm like, I don't even know if that still exists. I hope it does. It was a great thing, and many of his ambassadors came with us on these healthy aging initiatives to work with older adults and lead us in exercises. A lot of them are very engaged former athletes that people know, so it can be a great event to get people to engage and work with. And then I got to be a part of it, which was fun. Here's some challenges in community living. I think you all know the vast majority of people want to stay at home, but a lot of times they need support and assistance to do that. I did see that we have a lot of folks from rural communities in the room. I think 2 people from Arkansas, which was interesting. My husband's from Arkansas, so I don't run into people from Arkansas that much. Rural communities in particular are having big challenges with aging communities. This is based on the Rural Health Initiative Hub. Grantmakers in Aging also has an initiative on rural health and aging, which is a really big problem. You can see in this map there are several non-metro areas like Arkansas, Florida, and Texas. Some areas have a population of more than 25% over the age of 65. Young people aren't moving into these areas, and so there are many challenges there. At M.P.A, we run the Eldercare Locator, which is a national call center, which is funded by the Administration for Community Living. I want to share some data on the calls that we get and what we learn are most on the minds. Interestingly, most of our callers are older adults themselves and not their caregivers. As you all know, the need for support increases as people age. There was a recent study that found that 50% of those who are 85 and older needed assistance with everyday activities. And this population over 80 needs long-term services and supports. I know my friend and colleague Ann Tumlinson's going to talk more about that after lunch, so I'm not going to spend a lot of time on LTSS, but of this group, they are more likely to be female on Medicaid and have less than a high school education. On our calls, this is our latest data to show the purpose of the calls. The number one thing people call about is transportation, and that's been consistent for decades, which is really interesting. Home and community-based services is pretty close behind, people looking for how they can get help in their homes, housing options, medical services and supplies, and health insurance information. Jennifer touched on this in her talk, but again, just the overwhelming complexity of the Medicare and Medicaid system for all of us. I mean, I have many friends who have graduate degrees who call me when they become eligible for Medicare because they don't understand it. Do I have to pay this Part B premium? Am I going to get a penalty? What is on the plan? It's so confusing. And then whether or not your drugs are covered, that changes every year, what your copay is. And here's my little bit of advocacy. Here we make all these changes. We're expanding more than a third of people on Medicare and Medicare Advantage now, which is great and fine. I used to work at Kaiser Permanente. I think it's a great system. But at the same time, we have the state health insurance counseling programs that provide unbiased research. 2/3 of our area agencies on aging run them. Congress has been threatening to eliminate funding for SHIPs. So the amount of money that goes into our healthcare system and is spent on caring for Medicare beneficiaries, and we're not going to provide minimal funding to help people navigate this system. This is one of those issues that enrages me, so I will try not to get too angry about it. On transportation needs, I just want to note that the 64% of people call about immediate needs, not what they need in the future. How am I going to get to the doctor? And again, this is a disconnect we've seen with the healthcare system and working with older adults. Many health plans and others complain about the no-show rate, all of their patients that don't come. I'll tell you a little anecdote. We work with a AAA in the Boston area. They worked with a Medicare Advantage plan that said, yeah, our problem is people don't show up for the doctor. And so they said, okay, we can help you with that. So they started to go visit at home some of these people that didn't show up to the doctor. Well, one of the women lived in a 3-story walk-up. She was disabled, wheelchair-bound, on Medicaid. So the only time she could get to the doctor was when her husband was off work. He didn't have paid leave. He got paid by the hour. If he didn't show up for work, he could get fired because he would physically carry her down the stairs and take her to the doctor. That was how she got to the doctor. And that was why she missed her doctor's appointments. No one thought to ask. You know, my colleague in Boston, it was a great Boston accent I can't do, but you didn't ask why? They couldn't come to the doctor, you know, and it was, they couldn't get there. Once the AAA arranged for them transportation services, actually accessible housing, lo and behold, she never missed a doctor's appointment. Housing needs, another huge issue for people, and another area that's chronically underfunded, subsidized housing for older adults. Combating social isolation, which is a new issue, and people are really starting to take notice. There are 1 in 5 people over the age of 50 are affected by isolation. Older adults describe themselves as lonely. There's much greater risk of functional decline and a 45% greater risk of death. And then prolonged isolation can be as bad for your health as smoking 15 cigarettes a day. Finally, assisting those living with dementia. We've mentioned this, 1 in 10 people over 65 and 1 in 3 over 85 suffer from Alzheimer's disease or related dementia. 60% of these people with dementia live in the community. We find research from our friends at the Meals on Wheels Association of America. 1 in 4 of people that receive their meals at home have dementia and live alone. But now I'm going to try to be more hopeful because that was a little sad. We have a lot of great programs and a lot of great colleagues, many of you in this room who work on these issues every day and come up with new and effective strategies. One thing that came out of the White House Conference on Aging, we had 75 initiatives, and sometimes when I go back and look at the report, I'm really overwhelmed by how much we were able to accomplish. Was the beginning of Dementia Friendly America, which was launched at the White House Conference on Aging. It was modeled after a model in Minnesota from Act on Alzheimer's. And the goal there is to catalyze a movement to more effectively support those living with dementia and their care partners. It began with 8 pilot sites with the goal of having 15 DFA communities within a year. We have really exceeded our goals. Now, N4A is the administrator of this, so I'm really closely connected still with Dementia Friendly America. We now have over 200 communities, I need to update this slide, in 37 states, which is really exciting. Here's a snapshot of those. We've seen incredible interest. I think dementia is an issue that really cuts across racial and economic boundaries, any partisan differences. It really affects all of us, and people who have cared for someone with dementia or experiencing dementia themselves really get that they need more help in their community to work together. So we've been working, as I mentioned, or actively engaged across 37 states, and ultimately hope to get that there across all 50 states. Here's my time, Alexis, for a little video for you. This is from Dementia Friends, which helps people how to communicate with people with dementia.
If you saw someone living with dementia, would you recognize the signs? Would you be uncomfortable? Would you avoid them? Would you be frustrated? Would you do nothing? Or would you be a friend? Would you engage them and empower them to get through their day? Would you welcome the opportunity to help them feel like a part of your community? Would you take even the smallest step to make their world less frightening or confusing? Every single one of us has a unique part to play in the lives of people living with dementia in our community. Become a dementia friend today and build communities where all people can live, age, and thrive.
Hey, Mr. Fredrickson, it's Tuesday. Aren't you going to the store?
Yeah.
Come on, I'll walk with you.
Find out more at dementiafriendsusa.org.
Okay, if we go back to my slides, it's a great organization in the UK and Australia. It's really taken off. They have millions of dementia friends where you take little videos and you learn more about how you can help and work with people with dementia, especially ways to best communicate with them. Let's see, the Business Institute, as we mentioned, I'm the director of that, and we work to connect community-based organizations with healthcare sector. There's growing interest among the healthcare sector to work on social determinants of health. Community-based organizations really are the experts in these areas, especially working with some of the more complex patients, people with disabilities and older adults. And so we're bringing them together and trying to teach the skills to the community-based organizations of how to interact with healthcare. I saw from your group that you have some social workers on your roundtable, but also a lot of physicians. There's just the communication gaps just between the different professionals can be really challenging in and of itself, knowing how to talk about different issues and how health and long-term services and supports can work together. So that's one of the things we do there. We have a resource center, and it's really grown in terms of interest all over the country. And so if you want to see some of the resources that we provide to people, some of it's nuts and bolts. You know, what do you want to put in a contract to make sure you don't mess up, and then others that are more policy changes that are helping people. I want to make sure I talk about this program because this is one of my favorites. I don't know how many of you all are familiar with it, but the Geriatric Workforce Enhancement Program, which also was launched at the White House Conference on Aging, it's a HRSA project, and it brought together, many of us who've worked in aging have been frustrated about the lack of geriatric professionals and people that go, but it's one of the few specialties, geriatricians will tell you, where you actually go to school longer to earn less. So there's not a huge incentive for people to go into this field. And so HRSA has taken a different approach now and saying we're going to integrate geriatric education into primary care, assuming that's where more older adults see primary care professionals and teach them some of the basics about geriatric education. And this new, I think it might be out on the street now for funding, but there were 44 communities funded through this, primarily to the academic health centers. But what's so great is it not only encourages, it's a requirement to be funded by HRSA on this to work with community-based organizations. So one I wanted to highlight is one down in Texas at the University of Texas, North Texas, and these are some of their collaborators. One of United Way Area Agency on Aging of Tarrant County, which is Fort Worth area, is one of their key partners. And I'll just leave you with, this is one of my favorite programs, which is called the Seniors Assisting in Geriatric SAGE program. It reminded me of Dr. Thomas's barber shop, Go Where the Community Is. This one has interprofessional student teams, home visits with what they call senior mentors. So they really use homebound seniors to help teach health training professionals how to work with older adults. So they visit them in their home, they ask them about their lives, they get to see an older person for the first time, often in their own community setting. Some of the older adults will say, yes, my skin is much thinner, and it's my veins pop out. You can touch me, it's okay, and so they have these great interactions that we see with younger people. Medical residents that, many times it's the only time they've seen older adults outside of a hospital setting, will go and see the Meals on Wheels be delivered and note that that's the only meal some older adults receive for the whole day, and they're sharing it with their pets. So it brings a new understanding of what health means to physicians and health professionals. So prescribing a drug, as we talked about in the hospital, might not be the best way if these people aren't even getting basic nutrition at their homes. So really opens their eyes to that, and has been a great learning experience for both those community-based organizations and the academic health centers that work on this. So I think I'm out of time. Look forward to your questions, and thank you for your attention.